Rwanda lies at the center of Africa. Against the backdrop of its beautiful lakes, volcanic mountains, and terraced hills are multiple and daunting social and economic challenges. But reforms and progress in Rwanda have caught the world's attention, including the integration of a performance-based financing program into the national health system.
We are determined to address the healthcare challenges through a holistic framework. We have introduced an incentive program to attract health workers, especially in rural areas.
Leadership and determination of Rwanda's Ministry of Health is central to the success of this pioneering initiative. Management Sciences for Health, a global, non-profit public health organization, heads a project to implement performance-based financing nationwide. Performance-based financing provides incentives based on results. In Rwanda, targets are set for the quantity of basic health services and HIV services delivered, as well as for the quality of service in key areas. PBF rewards efficiency and results and motivates health workers at every level to do their best. Health facilities that reach their goals receive incentive payments directly, and following guidelines, facility managers decide how best to use the money.
The Rwanda HIV Performance-Based Financing Project is a 4-year project funded by USAID through the PEPFAR mechanism, and it was negotiated by the Ministry of Health to respond to 2 major challenges. One is to address the issue of improving quality of health services in Rwanda, and the second is how do we improve the motivation of health providers.
Incentives improve health workers' motivation, and they receive many of the tools they need to succeed, from supportive supervision and training that is integral to the program. Contracts outline performance requirements, so precise record-keeping, evaluation, and verification are essential. To ensure accountability, there is a separation of functions in which there is a purchaser, a service provider, and a controller.
This relationship between the provider, the purchaser, and the controller is enshrined in a formal contract where the performance or desired performance is clearly defined and broken down into indicators that have a price. After measurement, an invoice is produced that shows the performance that has been achieved, and the payment is done against the performance achieved.
Ubu kugira ngo n'aya manota atanga usanga ari ibitaro tugenda dusurana nto bakaza iyo muhuye rero akenshi usanga baragufasha ni exchange experience, hanyuma mukareba ibyiza mukora ukabasha no gukopera n'ibindi byiza, birafasha cyane kugira ngo uzamure na karite kandi habe na exchange experience.
The project's objective is to improve the access, quality, and efficiency of HIV and AIDS clinical services, while making sure that the program does not negatively affect primary health care services. To achieve balance, incentives are structured so that they support both goals. When a health facility fails to reach its goals, it will get help in identifying and remedying the causes for the performance gap. Sabimana Alois of the Gikumbi District Hospital visited Gisisa Community Health Center for just that reason.
Hanyuma natwe muri gahunda zacu nyine nk'ibitaro dufite inshingano z'uko buri kwezi nibura aho iyo twagiye kureba aho uko amavuriro ahagaze.
Despite many challenges and limited resources, Rwanda has been able to achieve significant improvements.
Lorsque vous voyez par exemple le suivi de la croissance des enfants, vous voyez que cette activité était presque abandonnée partout, elle ne se faisait plus, mais maintenant ils font attention à ça, et la plupart des enfants entre 12 mois et 59 mois, ces enfants sont suivis régulièrement à la pesée, Je dois citer aussi les cas d'accouchement en milieu surveillé. Le nombre de femmes qui accouchent ou le pourcentage de femmes qui accouchent en milieu surveillé a considérablement augmenté. Nous sommes autour de 60% maintenant et on est parti à moins de 30%, donc ça a plus que doublé.
PBF encourages an entrepreneurial spirit among all stakeholders. They are empowered to make decisions for themselves about how they will reach their goals. PBF gives them both ownership and responsibility for outcomes.
Bitewe nuko PBF yaje kunganira ibindi bikorwa, amafaranga y'imiti ntashobora kubura. Turangura imiti buri kwezi cyangwa se buri gihembwe, umuturage ashobora kuza umuti wose uwo abasha kuboneka kuri centre de santé akawubona.
PBF yaradufashije cyane kuko wasangaga kenshi kubera umushahara muto n'abakozi bagenda bakunze kugenda hirya no hino, ariko niba byatumye tugira icyo nakwita stability y'abakozi. Ikindi nakubwira nuko kandi iyi PBF yatumye tubona n'amafaranga. Amafaranga urabona nk'ubu iyi n'inzu twibakiye, amafaranga twabashije kugira umutungo kuri yo twabashije kuyubakira n'inzu nk'iyi.
Ikindi navuga ni ikijyanye n'uburyo abaturage bacu babyungukiyemo mu buryo tubaha serivisi zihuse, ndetse tujya tugerageza no kubasanga iwabo, tukabaha serivisi zimwe na zimwe baba bakeneye bitari ngombwa yuko baza hano ku kigo nderabuzima, kuko hari igihe kimwe na kimwe baba baturuka kure bikabatwara urugendo rurerure, bityo tubasanzeyo wenda tukabaha nka serivisi nko kuboneza urubyaro, gukingiza abana, kwipimisha ubwandu bw'agakoko gatera sida, birabafasha kuko bituma umwanya wabo bawunguka.
Abakozi bo ku kigo nderabuzima twarungutse cyane kubera yuko batwegereye n'ubundi bakajya bakingirira bugufi, bakatwigisha kwipimisha sida, bakatwigisha kuboneza urubyaro. Ibyo byose twumva byaratugiriye akamaro.
Interventions by the Ministry of Health with MSH and other partners to support PBF have been far-reaching. They have led to many positive results.
I would just finish by commending the Government of Rwanda for providing such a strong leadership and make it possible for the population to receive the services that they deserve.
A lot has been achieved, yet a lot is still desired. As Rwanda works to further reduce the gap, let us celebrate the positive contributions and the promise of performance-based financing.